I'm Dr. Bruce Karlin, welcoming you to another edition of Health Matters, brought to you by WCCA TV and the Worcester District Medical Society. Tonight, I am delighted to have as our guest Cherry Tangri, who is, let me get this right, Cherry, I don't want to shortchange you, public health prevention specialist for the community health team at the Worcester Division of Public Health, which is really important in the health of our city and a wonderful program. Welcome to the show.
Thank you so much for having me here.
So you're going to tell us all about the your coordination of the tobacco and nicotine-related policies and inspections, and tell us about what you're doing with tobacco education. This has become far more robust than the old days. We were talking beforehand, and I was remembering when John Gagliastro used to run the program when it was fully funded by the original tobacco tax, which the state legislators saw in their wisdom to sort of pull back on. But it sounds like you're getting funded now. Yep. Why don't you tell us a little bit about what your program is and what it does?
Yeah. So I am the prevention specialist for tobacco, and I have been in this role for about 1.5 years now. And in my work, I support the Office of Community Health in addressing health and racial inequities through their targeted interventions and programs. And specifically in prevention work, I do health education and enforcement of tobacco policies, both local as well as state, and policy promotion.
Did you study this when you were doing your master's at Northeastern, or was it more general?
Yes, it was more general.
But you're having fun with this now, and you're really focused on
yes,
this.
super thrilling.
Yeah. So, where would we run into you if we were selling tobacco? What would you be doing with?
So, yeah, typically I do inspections 3 times a year. So I would.
So that's every establishment that sells tobacco.
Yes.
Is required now by law to be inspected 3 times a year.
Yeah, and inspections are done in Worcester and our alliance towns, which includes Shrewsbury, Millbury, Grafton, and West Boylston. And so there are 3 kinds of inspections, and there are approximately 275 establishments combined, all towns, and 3 times a year. So now you know how many times.
So you're just going from place to place inspecting, it would sound
yes.
like.
So a typical retail education inspection is I walk in the store, educate the owner on all existing state and local tobacco policies. So just to give you an example, I go behind the counter and look for cigarette stamps. This is like the Massachusetts stamps. That means
so in the bottom of this
yeah.
is a stamp on.
Yeah.
And if they don't have that, what does that mean?
It's illegal.
How do they get it? Yeah.
We inform the DOR then at that point. So yeah, that's legal for sale if it has a stamp, and I also educate them that they cannot sell out of the box, like single cigarettes are prohibited as by state law, and they have to sell it through by the box. Selling loose cigarettes, it's a layman term, loosies. They call it loosies, selling loosies. Yeah.
Why would you sell loosies? I'm just. Can you get more for a pack of cigarettes if you do it individually, or that's crazy? All right.
And then even they cannot distribute it for free. Like I had a complaint regarding a retailer that said that they were selling like to the homeless or giving it for free. Things like that keep happening. So education becomes really important. And the other part is I look for humidors, which are cabinets that store high-end cigars. They have to be locked at all times if it's a grocery store or a convenience store setup. If they are present in smoking bars or adult only, they could be open because by state law, they restrict under 21 anyways in their store.
So I'm just wondering about the wisdom of the laws. Do you think they're preventing or helping to prevent the early starting of smoking?
Yes, we will talk about that. That's the flavored cigar regulations that Massachusetts went on to be the first state to restrict the sale of flavored cigars. And there are a lot of layers to this.
When I was a kid, we're talking, the 18th century, they used to give out candy cigarettes. They looked like cigarettes and they were candy. And obviously that was to try to get everybody to smoke it. What was the highest penetrance of smoking in the United States? Was it like 60% of people smoking during World War II, something like that?
I do not know
that might be
that
might be false. So they'll correct me later on that. But there used to be a much greater percentage of the population smoking, and part of it was that they figured out triggers to get us to start.
Yeah.
And so the tobacco laws are basically aimed at some of that. So the flavored tobaccos can only be sold
in smoking bars.
In the smoking bars.
Only for on-site consumption. The customer cannot bring it out. And then there is also the state law put a 75% excise tax on the non-flavored vape products. And under this law, they have also restricted nicotine sale in the non-adult only stores. Meaning if a gas station wants to sell a vape product, so they can sell a vape product with nicotine that is 3% or less. Whereas if it's a adult only store, they can go by 5% or more. And there is more to it. It doesn't end here. Any product that relies on vaporization and aerosolization is covered under this law. Say there is a vape product, so I have a picture of this one. This is zero nicotine and it's flavored. Even if this were hemp, CBD, even vitamin, the retailers cannot sell flavored products except smoking bars.
Okay. I'm always wondering about whether more or less percentage nicotine is good or bad. It always seemed to me that those the quote light cigarettes that they used to sell just had people smoking more cigarettes, and I'm not sure what the laws do, other than we're continually restricting who can smoke, which is, I think, a good thing. Yeah. When the Medical Society first talked with the state legislature, when they were instituting the first tobacco tax, they were debating, should we do 12.5 cents or 25 cents? I can remember, I think it was our former president of the Medical Society, Dick Agababian, said, this would be a benefit if you threw the money into the harbor. He said, just raising the price on things and putting more restrictions in keeps people from smoking. And when you get right down to it, most of the people that come into my office that smoke, if you get to their heart of hearts, they really do want to stop. Yeah. I mean, once you're hooked, you want to quit.
Especially when it's all about flavors that youth initiate and then they cannot stop. And also, all these flavors contribute to health disparities. Especially when we talk about menthols, it's an additive compound that numbs the throat and it masks the harshness in the tobacco. And also how the big tobacco industries have targeted our communities of color, specifically when it comes to African American people. And I did read a study where the numbers were like 85% of African Americans are hooked to smoking menthol cigarettes.
Menthol cigarettes, yeah. Wow. So you go into these establishments that sell all these goodies, and you tell them, here's the law, and how else do you keep their toes to the fire?
So we, apart from doing these retail inspections, we also do youth compliance inspections. We hire youth between ages 16 to 20, train them, take them out to attempt a tobacco purchase, and if the sale is made, then it's $1,000 fine, because the state fines have gone really high, ranging from $1,000 to $5,000, including permit suspensions.
Entrapping the yeah. Well, but it's you're telling the folks that you are inspecting, expect this. This
Yes.
is what we do,
Yep.
and so it's not truly entrapment, but it's
And
making
when-
sure that
yeah.
they're paying attention.
During the retail education visits, we tell them to, a lot of emphasis is on checking IDs. So I follow the state guidance and tell them, try to check, everybody's ID, regardless of age. It's called the Fenway rule, what I learned about. So, doing that would, because sometimes what happens is some youth may look older.
So I'd be delighted to get carded again, but that would be different. But you're saying check everybody before you
Yep.
do it, because the fine is stiff.
Yes, and there are these gas stations, 7-Eleven and other different gas stations that also tell me that their companies do these compliance checks all the time.
So their own company. So if you
Yep.
7-Eleven sends out its team to say, make sure that you're not selling to youth.
They call it spy inspections or something, but everybody's aware of these inspections. And then the final is the enforcement. When I go visit the establishment, any violations are found, I give them the citations, and accordingly court hearings are also done.
How often do you end up doing something
So
like
with
that?
the flavor restriction, it's been on the rise a lot.
1-2 cases a month, or is it?
So there are different reasons. So one is if they did not pay the fine within the 21-day period, we take them to court. The other is if they appealed the ticket. So lately, last year there were a lot. This year, not so many.
Okay, so in other words, the enforcement, the threat of the fine has worked very well in terms of getting people to comply to not sell to youth.
Yes.
Are there other restrictions that they miss on that are important?
Yes, there are some. So within this state law, the newer state law, there is another requirement that retailers require something called as manufacturer letters. So it's basically a certification from the manufacturer that the products that they are selling do not fall under the definition of flavored tobacco or tobacco product flavor enhancer. And also there is another letter that validates their nicotine content. So basically they have to have these letters at all times in their store.
So the biggest things that you're doing in your tobacco enforcement is to make sure that all of the stores, all 275 under your purview,
Yep.
are not selling flavored anything,
Yes.
unless it's in an adult
Smoking bar.
smoking bar, and are not selling to youth at all.
Yes.
And it sounds like your enforcement measures are such that pretty healthy respect for that, so that the youth have got to be getting it some other way. So what other things do we do in the Department of Public Health to cut down on smoking?
So health education is around, like we said, it's delaying the first use of tobacco. So we administer regional youth health survey every 2 years, and whatever data we collect, so this survey is administered in middle schools and high schools. Whatever data we get, and it's analyzed, and based on the school needs and the data needs, action steps are determined.
So, so typically what would happen, like you go to, like Grafton is one of our towns, you go to Grafton Public Schools and perform a survey there?
So that is administered, yes. And for 2021, they did do it through the department in the month of December. And right now they are doing the analysis and report writing. So based off that, whatever results come up, we do a presentation in the schools on these are the results, this is going on, and then whatever the need would be, we would determine what to do next.
So can you give us an example of what went on, say, in 2019, although nobody was at school in 2019?
Yes,
but you've been there for a while.
I joined in actually 2020, so I'm not sure what exactly they did for that part of the
training.
Yes, so.
But
this is the normal routine that happens.
Okay, you've got some signs here. What are these about?
So these are also something that the state requires all establishments to have in store. They post it on the walls, and some of them are specific to adult only and smoking bars.
So cigars are not a safe alternative. It's illegal to sell tobacco
under 21.
It's illegal to smoke in this establishment. So where do you put these?
So yes, so there is this Massachusetts smoke-free workplace law that prohibits smoking in workplaces, restaurants, and anywhere in schools, especially when it comes to municipal buildings. And
turns out that smoke can waft from one place to another.
Smoke migration, yes. And this law was actually adopted in July of 2004 in Massachusetts, and before that it was like legal to smoke in
any place. Yeah.
Smoke
on airplanes, for God's sakes.
That's the state law.
State law.
Yeah. MGL Chapter 270, Section 6.
Cigar smoke contains carbon monoxide and nicotine. So it's probably the carbon monoxide that's doing us all in, according to some pulmonary experts. So these, now do you provide these for anybody that wants them, or do you say, hey, you are an establishment that comes under our purview, you need to put this up someplace? Or is it mostly that people are asking for them and you provide them?
So they have to have them, and if they do not have them, they have to ask me, and I also provide them resources.
So this is for your 275 establishments.
They can also go online and print them.
Do other people ask for these signs?
No, these are a requirement for only retail establishments.
Only people who are selling tobacco.
Yeah.
So what other things does the Department of Public Health doing in regards to education? So we have, the enforcement arm where you're going around and saying, here are the things that we've got to do. I know back in the day there were specific programs where we go to high schools, where the DPH would go to high schools. Do we have any of that cranking up, or is that in the sites?
Yes, that we are in the planning phase of working up. So we have another grant that we are trying to tie it up with the health education part, and so it's just in the assessment phases. We are tying it up in different sections, and we would, I believe, we would get those educational resources through BSAS at this point, because that grant is through BSAS.
So you get the grant.
It's a different grant, for something.
Is that going to come under your purview, do you think?
So it's basically about delaying first use around tobacco, marijuana, and alcohol. So I do the tobacco part wherever there will be need for tobacco education, vaping education, I would step in.
And so are the tobaccos, are the only places you can sell vape products in these stores, or are they available elsewhere? The vape products.
Vape products are available they are allowed in Massachusetts. The non-flavored ones, they are allowed in all establishments except, and based on the nicotine content also, keeping in mind. And the flavored ones are only allowed in smoking bars.
But are they available outside of these establishments? I mean, are people getting them online or?
Yeah. Easy access.
Do you have? Is there any training going on in the Department of Public Health regarding vaping, and the pluses and minuses of it?
For the schools, you mean?
Just for the general public, or for the people that are selling them. Are you allowed to sell them, forget online, are you allowed to sell them outside of your 275 stores any place?
So if they are so I enforce only in the stores. So if they are doing it outside or not, I'm not sure what's happening there.
Okay.
But my jurisdictions is only to enforce within the limits of the store.
And what's happening with the vape products? Because the science on that is evolving, and I mean, when they first came out, we doctors were all excited. We said, "Hey, here's something that'll get people off of cigarettes," and it turns out that it becomes an addiction unto itself, and it has other problems related to it. So, are you trying to get people off of vape products, or
So we would provide resources for anybody who is looking to quit, and it's through the Mass Department of Public Health, the Quit Works. That it's a referral program that the health providers use to refer patients to 1-1800 for the helpline. And they offer evidence-based strategies around numerous topics such as how to set up a quit date, how to manage cravings, and also keep up the motivation to quit. And it's a telephone-based coaching strategy, and they also have this texting options for 12 years and older, and if somebody is 18 and older, they also offer nicotine replacement therapy.
Wow. Who thought that this would be something that we'd be getting into? Now, do you get into that at all, or is that going to come under your purview at the Worcester Department of Public Health, or are you going to rely on the state program?
Yes, so our work is mostly prevention, and then we also get complaints where we have tenants or community landlords who want to make their communities smoke-free.
Smoke-free.
Yeah, and then we direct them to makesmokinghistory.org, which has ton of resources on how to do that. They also have
How do they do that?
We will have to visit the website.
Okay.
They have tons of resources for each town as well, I guess. Yeah.
Well, what other resources, we've covered a lot of ground in terms of other resources that you get called upon for referrals. Do you have other referrals that you make in the course of your day, other than, here we're watching you, we're going to send out some people to test to make sure that you're paying attention, and we're going to help you put up the signs. We're going to direct people that call to resources that will help them. Other than people that want their personal space smoke-free, do you get other calls that you need to respond to?
So if there are, we have been getting so many complaints since this law has been adopted in Massachusetts, that retailers are selling flavored tobacco products, so I go and follow up on that.
So, which retailers under your purview, or?
Yes.
Okay.
Only in.
So you get,
Yeah.
people say, hey, Joe's Smoke Shop just sold flavored stuff to leave their premises. Do you?
Yeah. So yeah, because if one retailer isn't selling and they see that the other is like selling illegally and making more money, so, and it's illegal, right?
Yeah.
Making more money is a different thing, but it's illegal. So one retailer is abiding by the law and the other is not, so it's not fair. So we look into the establishment, all places.
Would you say that for the most part your establishments are pretty much honing to the law?
Yes, there are a few repeat offenders, but most of them have been compliant.
So, if you had one thing to tell us about the value of what you're doing, where do you see your biggest impact?
I think with the flavors going down, the work is really about, preventing the first use. That's the biggest portion of what I am going to do, because I haven't started, and because of COVID, all this was at pause. So that is started to revamp in a different way. So I'm really excited to get into that health education role soon.
Well, and this is the stuff that you're planning for now in the
Yes.
thing. Well, this has been wonderful. You may not realize it, but we're coming up to the end of the show here, and it's been wonderful. My guest has been Cherry Tangri, who, I will again repeat it, is the Public Health Prevention Specialist for the Community Health Team at the Worcester Division of Public Health. And I think this has been very educational, and we hope to have you on again to talk about all the good stuff. This is Dr. Bruce Karlin, wishing you all well and smoke-free existence. Bringing you another edition of Health Matters, brought to you by WCCA TV and Worcester District Medical Society. Thank you for watching.